Joining us this morning on Studio 3, we have Dr. Christen Simpson from Simpson Dental. You know, we're talking about obstructive sleep apnea. I think a lot of us have heard of sleep apnea, but what is this type?
Well, obstructive sleep apnea just means when there's something actually blocking your airway. So that's where there's, either your airway is closing off when you're sleeping and you're not getting the proper amount of oxygen that you need to function. So it actually affects about 40 million Americans, and less than 10% of those sufferers have been diagnosed. And of that 10%, only 25% have been successfully treated. So it's something that's definitely very prevalent, and we need to make sure that if it's something that affects you, that it's getting treated, because it can actually lead to morbidity.
Oh my goodness. So don't let this one go. You've got to get it checked. What are some of the symptoms of this?
So when it comes to sleep apnea, one of the main symptoms would be, of course, snoring. So snoring is something that your significant other might have told you is happening, because you probably don't know, but that's one of the main things. And then, of course, insomnia or memory loss is a big one. Mostly short-term memory. You can be fidgety throughout the day and just fatigued. You just don't feel like you're rested. So it has a lot of side effects that affect you in your day-to-day living when you're not getting that proper sleep that you need at night.
What is the screening process like for this, and can you get a sleep study done to tell if this is what you have?
Well, a great way to have the screening done is when you're at your regular dental checkup. We're always checking in your mouth, and in your mouth is where one of the places that we see it. So this is a Mallampati scale, and you can see in the back of the throat how open the back of the throat is on the left-hand side. And by the time you get to the right-hand side, it's completely blocked off. So we can see down your throat when we're doing your oral cancer screening, and we can tell if that airway is blocked, and can recommend you to have a sleep study if we see some of these signs that it could be an issue for you. So with those sleep studies, you can do a home sleep study, which is what we have at Simpson Dental, where we will give you what you need to just take home, connect the parts to yourself, and just sleep in your own bed. Or you can go to a facility and have a more advanced sleep study done, where you're actually sleeping there and they're monitoring you the whole night.
Oh, okay. So what happens after you get the results from that sleep study?
So once we get those results, we can determine which way would be best to treat you. If you have a very severe case, of course, we're working with your primary care physician as well with these. You might need the CPAP machine. That's if it's a severe case, and if it's more of the centralized sleep apnea, which means that your brain just isn't giving your body the signals to breathe. But if it's the obstructive kind, which is where your airway is blocked, then a sleep appliance is going to be the best thing, because that sleep appliance will bring your bottom jaw down and forward, which will help to open up that airway and can help to get more air in, so you're not having that obstructive problem.
I've also heard that there is a treatment with a laser. Tell us about that.
That's right. So we have a CO2 soft tissue laser that helps to treat the back of the throat where it's collapsed. So this soft tissue laser just helps to tighten up that tissue to open up the airway. So it takes probably multiple treatments, up to 3 treatments, and this is actually the same technology that we use for treating facial aesthetics. So it helps to promote collagen and regrowth in those cells to help tighten up that tissue, which is also what helps on the face with fine lines and wrinkles. So it's definitely a great procedure that we've seen people get good benefits with.
Okay, so if someone listening today and they want to get more information or come in and talk to you about the sleep study and all this, what's the best way to do this? How do they get this started?
So you can call our office, the 342-6162, or you can go to wvsmiles.com, and we have a lot of information there as well.
Yeah, and then hopefully you'll sleep a lot better. Dr. Simpson, thanks so much for sharing this with us today on Studio 3.
Of course. Thank you.